Welcome to Pieces for My Puzzle. I'm your host, Nikki Ship, and I'm excited to be sharing with you my life with a son on the spectrum. This podcast is for anyone who is looking for quick tips and perspective, but most of all, for hope and inspiration. So sit back, relax, and let's put the pieces together. Hello and welcome back to another episode of Pieces for My Puzzle. I'm your host, Nikki Ship. Thank you so much for joining us today. Last week, we had the great pleasure of speaking with Dr. Nikki Robinett, and this week we are going to continue our talk with her. She is a dedicated physical therapist with 9 years of experience in pediatrics. Originally from Minnesota, she's lived in Arizona for 11 years. Her passion for helping children began when babysitting and nannying, and it was strengthened even after her father's injury, which led her into the field of physical therapy. She now has a company and has founded a company called Moving and Grooving PT to eliminate mom guilt, as well as a gamut of other physical therapy services, but she offers mobile and virtual. Her classes, she also has classes that help to educate families on child development, success strategies, and even prehab techniques. Thank you so much, Nikki, for being back on the show today.
Yes, thank
you.
I'm
so excited. And for those of you that listened in last week and tuned in last week, I really hope that you were able to get some really valuable information from our conversation. I felt like you gave so much value in talking about combating not just the aspect of what goals are within physical therapy, but also combating maybe some mom guilt that a lot of parents and moms specifically tend to feel when going down this rabbit hole with their child on the spectrum. So, so if you didn't get a chance to listen to that episode, please do. So I kind of wanted to jump in today and ask you about maybe some specific therapies and techniques. You know, which ones do you find that are really the most effective for children with autism?
Yes. So what I have found to be really helpful is keeping in mind their sensory needs. Last week we talked about the differences between occupational and physical therapy. Yeah. And a lot of the neurodivergent kids, like kids with autism, have those sensory needs. So again, taking what they like and applying it to the therapy session to make it more therapeutic in nature. Mm-hmm. So that could be looking at their sensory profile that the OT has already gone through and scored, and collaborating with them on what are some sensory inputs, so such as vision, like can we dim the lights to make them a little bit less distracted?
Right.
Or if they really need more visual input, can we have some like flashing lights on to draw their attention in? Okay. It's incorporating more vestibular movement, which is how our head and our body move, mm-hmm. where our body is in space. So can we do some more swinging activities? Can we do rolling, mm-hmm. crashing, things like that? And then for kids who are getting overwhelmed, sometimes they really just need that deep tactile input. So giving them squeezes, giving them a tight hug, maybe carrying them for a little bit, mm-hmm. so that we're meeting all of their sensory needs in order to stay regulated so that they can attend to our physical demands and follow those 1 or 2 or 3 step commands to be more functional in our day-to-day living.
Yeah, and it's such a good point that you bring that up, because that's something that I didn't realize at first as a parent, is addressing the sensory issues. You know, when they, like Drayson would move around, or we had to do what we call squeezies. You know, we would mm-hmm. squeeze real tight and squeeze, and we would hold on to him, and that helped him. I think one thing that I didn't understand at first as a parent was that was how he was regulating. You know, the initial reaction is, I just want him to stop. Like, I want him to stop pacing or moving around.
Right.
But if I did that, the reaction was, or the behaviors would come out tenfold.
Absolutely.
So I think that it's a good point that you bring up that is a part of their autoregulation, that they need that incorporated into, as well as with the physical therapy itself.
Absolutely. Yeah. So the more that we ignore it, the more that we shame it and say that's not normal, or don't do that, that's embarrassing, or you can only do that in private. That just, if we say no and we don't show them what to do, it doesn't help.
Right.
So we have to show them, okay, if you really like rocking back and forth, let's incorporate something that can help you meet that need so that you can attend for these other things. But the shaming and saying no, don't really just doesn't help us problem solve beyond that.
Yeah. And I think too, it's a level of frustration that we feel as parents, right? Because we don't know, it's telling, like I've told Drayson, to stop doing something, but it's out of my frustration or out of my, again, predisposition, my preconceived notions about things or whatever. It's like I've had to stop myself a few times before and go, okay, but this is what he needs. This is the sensory input is what he needs. He's obsessed with carrying around a hanger, like the I don't know if it's the cylinder shape of the plastic or what, but for whatever reason, it's always a hanger.
Yeah.
And so we had to put some things in place that, I've been with him in a grocery store and he's carrying a hanger down the aisle, but guess what? He's acting appropriately otherwise.
Yeah, he's not throwing a tantrum.
I'm like, he's not having a tantrum or meltdown. So guess what? He's just going to carry around the hanger around the grocery store.
Yes.
But I think that it took me a long time personally to recognize that was a need, that it wasn't just an unnecessary behavior. Like, I think that's what sometimes it gets categorized as.
Absolutely.
Is that, that's, because it's not socially acceptable, So, let's talk a little bit about kind of motor milestones, and why they are important and how parents can help their children achieve kind of those mini milestones. Like I was just, talking to somebody about celebrating the little wins, right? And I think sometimes we think that we should have this huge end result, but really it's the little things in between, I think, that are even bigger milestones. So, why would you say that some of these motor milestones are so important?
Yeah, so in case you're not familiar with what a motor milestone is, those gross motor milestones in terms of what PT would target would be in infancy, things like holding our head up in tummy time, rolling over, sitting by ourselves, standing, walking.
Okay.
And then as we get older and our bodies can handle more, that would be jumping, running, riding a bike, riding a scooter, climbing a rock wall, things like that. And so those are important, not only because that shows that our body is able to hold ourselves up against gravity, but it also requires a lot of coordination. And going back to what we talked about last week, if kids are not able to participate in age-appropriate activities,
right,
they get left out.
Yeah.
They feel more isolated. The parents feel more isolated because they can't connect with others, and they feel ashamed when it's time to bring them to whatever tryout or PE class. And so if we can help a child learn how to use their body and learn how to sit up straight so that we can, do these higher level tasks, they can have more interaction with others. They can stop dreading these family visits to the park, and the parents can have, again, that more of that connection. So working on those bigger milestones and then also breaking it down as to why is this hard for them?
Yeah.
Why can't they do a jumping jack? Is it that they're not strong enough? Is it that they don't know where their body is in space? Is it that they have pain every time that they land on their foot? Things like that. So breaking down those tasks and then figuring out how can we modify and enhance or limit so that we can do this task better.
And you bring up an interesting point of the self-confidence. The sometimes I think we don't realize, that it does stifle a person's confidence if you feel like you have a limitation. And if you already know that you're different, I would tell people for years that even though Drayson couldn't speak, it doesn't mean that he didn't have feelings or that, he wasn't being targeted as different because of, the state of isolation, physically and emotionally, that he might endure. But when they're able to master something like a major motor function like that can instill self-confidence in that child, right?
Absolutely. Yeah. And they feel like I can and I am and I'm part of.
Yes.
And the more that we can build up those feelings, just like we can reduce those feelings of mom guilt together, that really creates this like really special end product. And that's what we really need to work on together as therapists and families.
Yeah. And I know I can only speak from my personal experience, but watching Drayson's progress, it's helped me even with my confidence to keep going. Yes, he did it. Okay, now I want to do more. Now I want to push harder. Now what else can we look into? Because I want him to try to go to that next level. And I think it's just as equally important for parents to feel empowered as well, which is why I really love that you bring in that component with the physical therapy aspect. Yeah. So can you explain to our listeners how physical therapy can play a role in preventing surgeries and other medical interventions later on in life? I was just speaking to a mom the other day that her son, who is tippy-toe walking, now has to have surgery because he can't bring his feet down. We are very lucky that we don't have that problem with Drayson, but can you explain how physical therapy can play a role in preventing some surgeries and other medical ailments in the future?
Absolutely. Yes. So oftentimes when people think of physical therapy, they think of what it is for an adult.
Yes.
And when I introduce myself as a pediatric physical therapist, I have people be like, I don't mean to be rude, but like why would you ever do that? Like, why would a kid need physical therapy? Right. How would that help? And like, how do you tell a kid to do squats is my favorite question. Right. How do you tell a baby to do squats? So, when we think about pediatric PT, sometimes it is because they're in pain, or sometimes it is because they had surgery and they need to recover after, but a lot of it is prevention.
Okay.
And so there is a state-funded program called Arizona Early Intervention, or AZIP, and early intervention really focuses on birth to 3.
Okay.
So if you can get in with a child when they're starting to show some motor delays or they're starting to show some red flags, you can start to retrain them on what is appropriate. So, for example, if a child, like your friend's child, is only walking on their tiptoes, starting PT right away so that you can learn, why are they tiptoeing?
Right.
How can we give them that input in a different way? And then here's some positions and stretches and exercises to actually lengthen those muscles that have gotten shorter that causes us to go up on our toes.
Right.
Or kids, generally kids with autism and low muscle tone, tend to do this W sit position.
Yeah.
So they sit with their feet behind their hips. They're kind of curled over in their back. They have a forward head posture. Sometimes those kids drool or they have a hard time articulating because their body is just not in alignment.
Yeah.
So PT would come in and say, hey, their hip socket is a little bit loose, or these muscles are a little bit tight, and it's just pulling them into these positions. And if the muscles on the joints are pulled too much, the bones shift as well.
Yeah.
And so once the bones shift, we really can't do anything except for more drastic interventions like surgery.
Okay.
So PT can help teach different positions and stretches, and then also recommend things like orthotics or braces. So like sometimes you would see kids walking around who have leg braces, or you would prescribe a different type of a walker or a stander so that the child can be more upright so that they don't develop scoliosis later in the future, and then possibly need surgery later on.
Right, yeah. And and that is something that you can look at holistically with parents, right? When you're in the session with the child, to know that could potentially be something down the road that could become a problem.
Yeah, and good things for parents to just kind of keep track of, because again, you're not the expert. You're the expert at raising your child, and we're the experts at coming in for the mobility.
I try to be an expert even at raising my kids, but I don't know about that either.
But yeah, like the way that you would notice that would just be like, okay, I notice that these other kids are doing this. I notice that they really struggle playing games with me because they're always leaning.
Yeah.
I notice that when they started to try to crawl, they'd always have one leg out. So think of it like Are they moving their body in the same way on both sides of the body? Does the right leg move the same as the left leg? Mm-hmm. Are they able to sit in a chair comfortably? Or do you change your dinners so that they can sit on the floor watching TV because that's what they're happiest doing, but now they're starting to have that curvature in their spine?
Yeah. Just this talk alone makes me want to make sure I'm sitting up straight. I'm like, oh my gosh, am I sitting up straight?
Exactly.
Do you have any success stories or, even personal experiences from all the work that you've done that you would like to share with our listeners about, just to offer that hope and encouragement? This is my favorite part because this is when I call it the moment of belief, right? When you realize like these children are capable of so much more.
Yeah.
And you see those milestones happen. But, do you have any success stories or personal experiences you'd like to share?
Yeah, I have a few. So I think my favorite very pre and post example is I came into a family's home with a child who had a new diagnosis of autism.
Okay.
And the child had very little body awareness, very little protective responses, so they weren't able to put their hands up to catch their fall, and very limited ability to just like stand and sit still. Mm-hmm. And so their whole house was padded. Everything literally padded.
Oh my gosh.
Because they were so worried that the child would be walking or running or tripping and not be able to catch themselves.
Oh my gosh.
So after quite a few sessions together, I am now able to let that child sit and attend a game with me. Mm-hmm. They're able to walk and stop, run and jump without tripping and falling. They're able to go up and down the stairs. They're not falling and injuring themselves, and the house isn't padded anymore.
I was going to say, the house doesn't have to be padded.
Yeah, so like when you think about a child with a disability or a condition or some sort of diagnosis, you really need to come in and think like, how is this affecting me as the family or the provider or whatever? Right. And so that's not even something the family said. Like, we're so worried about him falling. They were just living in fight or flight mode.
Yeah.
Truly. And so it's been really, really cool to be like, look at how much you can do and look at how much your anxiety has gone down just letting your child exist in your house.
And how
right?
liberating as a family. Because they don't have to be scared or worried to that degree.
Exactly.
Right? To that magnitude of literally padding the house.
Yeah.
Oh my God.
Yeah, and then some others are just that I have another family who wanted their child to do more functional things, and so they've gotten a rock climbing membership, and we started with a child just looking at the rock wall and having a lot of behaviors, just being there, being overwhelmed, right? Can't even really stand up and participate, to now climbing several feet up the rock wall and being able to hold their body up and not panic and want to do it again.
Right.
And that is just so empowering, and sharing that with families is really what makes my job so much more rewarding. Is look at what you trusted me with, and look at what we've been able to accomplish together because of that trust.
Yeah.
And what you're able to incorporate into your daily life when I'm not there. Yeah. So those have been some of my favorites.
Yeah, and it is hard, I think, as a parent to, when you start having therapies and people are coming in and out of your home, or you're taking them to therapies, one thing that I didn't realize until later was that I really had to trust my providers.
Absolutely.
And Drayson also. I always tell him, like, listen, Drayson's a hard sell. Like, every new therapist that comes into the house, I'm like, listen, he's not going to warm up to you right away. I'm just letting you know, like, he's a hard sell. And so do you find that is it harder for you to develop the relationship with the child or with the parents, or has it been kind of a little bit of both? You know what I mean? Because the trust factor for me, I might be a little bit more, like, Drayson's definitely more guarded than I was. So do you find that you have to kind of instill more trust with the child first or with the parents first, or is it kind of just depends on the family?
Yeah, so it depends on the family. So I have I guess he's an adult, an adult with autism, and this family has had the same occupational therapist for, I want to say, like 20 years.
Oh, wow. Okay.
And so they really trusted that OT. And they weren't able to find another PT to come to the home, but he had other issues that were limiting his ability to leave the house. And so it took almost a year for the OT to convince the mom, hey, I found someone who is safe. I've seen what she does with other kids. I trust her. And then going in and meeting, you know, the mom and the dad and being like, hey, this is what I'm going to try to target, but you tell me what you're comfortable with.
Right.
And so if the parents are there and they're like, we don't do that, that's a nice sign for me to be like, okay, there's something behind this. Let's kind of keep it in the back of our mind and think, should we come back to this, or is this an off-limit thing? Like, why is this not an okay thing?
Right.
But also going back to, does the kid trust you? I have another family who they say, you know, we worked with a speech therapist for 6 months, and she doesn't even, you know, let the speech therapist touch her. So don't expect to do hands-on work with her. Just know that.
Yeah.
And the kid has started to come up to me and touch me and share things with me and be okay having me, you know, move her foot or move her hand and not having these meltdowns. So having the parents explain what they are okay with and trusting you then helps the child be like, okay, you know what? Like, I think you're okay. I think I'll let you near me and be all right with it.
I will give you that high five today. Yeah. What advice would you give to parents who are considering physical therapy for their children, but they're unsure where to start?
Yeah. I think what really it comes down to is thinking about your goals and your priorities as a parent. So do you have goals for your child to be more physically active and able-bodied? Do you have goals for your child to be able to participate without throwing themselves down on the sidewalk because it's too long of a walk or things like that? Or do you need to focus on these other behaviors or their communication first and thinking about, like, what am I capable of focusing my energy on as well?
Right. Yeah.
Because sometimes kids have needs in like 10 different areas, and then the parent goes through burnout. And then they get the mom guilt coming back that I should be doing this and I'm not. And it's really important to scale it back and be like, you know what? This is important to me, but it's less important to me than being able to sit still.
Right.
Than throwing ourselves down whenever I have to go to Target to make a run because they're too tired or their feet hurt too much. So looking at what is an age-appropriate skill for my child to be doing.
Right.
And then thinking, is this something that I really want to focus on? Because, too, even if you have PT coming in 3 times a week, if you don't follow through with those recommendations, the progress is going to be a lot slower.
It changes,
Yeah, so that's why you have to figure out your priorities, and it's okay to take, you know, a break and shift focus, and your therapist should be very understanding of that too, or be able to work with the other therapists and say, hey, we're going to take a break. Could you focus on these 2 positions when you're doing your OT or speech therapy or ABA and things like that? But also I offer a free consultation too. So if parents have concerns and they're like, I don't really know if this is right, they can always reach out to me and say, hey, I think that this is a concern. You can send me some pictures or videos and we can walk through, like, hey, why don't you just try these few things first and then come back to me?
Yeah. And that's so great that you offer that, because I think when I sit down and I talk about Drayson's goals or what we want him to accomplish, it's incredibly overwhelming, because it's not just, like you said, it's not just one thing. It could be 10 things. It could be 20 things. But how do you know which ones to look at first or attack first. And
Absolutely.
so I think that it's a great perspective that you give by evaluating that and just helping, even to help parents narrow it down, because I would suspect that you've walked into plenty of homes and worked with families where the parents are in a complete state of overwhelm.
Absolutely.
Yeah.
It is chaos.
Oh, yeah.
And you can tell with the way that they can't answer questions.
Yeah. I've had, and that's never happened to me.
And that's so normal, right? Like, it's
Right.
normal for a child who is typically developing, and it's especially normal for a child with delays or an actual diagnosis. And so, yeah, like, you just have to be real with yourself and think, what am I willing to invest in right now, and how important is it?
Right.
And no one should make that decision but you.
Right. And and I think that that's been something that we've focused on, is at the core of the family unit, like what's also going to help all of us too as a family, not just for Drayson, but for all of us, because there is a level of support that you don't think about that you need.
Absolutely.
And moments of where you need to take that break and stop yourself, because I've definitely experienced burnout on several occasions, where I've just said, okay, I've got to take a step back for a minute and just kind of collect myself so that I can keep moving forward and I can keep doing those things. And I would think that, especially if they're looking for a service like yours and they haven't found one yet, it's easy to walk in and go, okay, they're really stressed out here.
Yeah.
How do we prioritize, where to start chipping away at things,
Yeah, and that's where the therapy side of physical therapy comes in, and really dissecting, like, where are you at emotionally and mentally. And it is physical therapy, but that's why I'm offering this other coaching program, because a lot of families, I am a coach.
Yeah.
I'm their main, what we would call a team lead in early intervention, and I'm your point person. Let's talk about, okay, first you have 18 referrals. Which referral do you want to do first? Okay, How can we do that? And incorporating different strategies from different specialists into those sessions, but having someone on your team that you can trust.
Yes.
And you can say, you know what, like, I'm feeling really disconnected from Drayson this week. I'm really struggling with my guilt this week. I didn't do it. So you can say, you know what, I know you always ask me what we did this past week, but can you just focus on teaching him something new instead?
Yeah.
And so being really honest and vulnerable with your providers will only help build that trust and figure out what you can tolerate as the caregiver in that moment.
That's a really great point. I think being vulnerable is one of the hardest things I've had to do, especially with the therapists.
Yeah.
Because you're first of all, you're talking about your child not in the best light, right? You're talking about their limitations, and no parent wants to talk about their child. You want to talk about the best version of your child always, right?
Of course.
So you're already talking about limitations, and then you don't realize that you're coming in with, like I've come in with severe burnout, and I've said, I remember one therapy session I had with, I think it was this occupational therapist, one of the therapists, but I remember saying, I was like, I can't today. Like, I just couldn't even, I know that these goals need to be addressed, but I don't even know. Like, I was just in such a state of overwhelm and burnout, and I don't think sometimes we neglect to address that as parents, and even as providers. I'm sure sometimes to really look at that, you guys really have to look at the whole picture.
Yeah.
And I'm sure, so now you've also, I'm assuming, have had to work laterally with other therapists, like OT, speech, just to, I always say it takes a village, right?
Absolutely.
Like, I need to know where my tribe is to help Drayson. So I take it that you also work laterally with a lot of these other therapists as well.
Absolutely.
Yeah.
And I'm constantly expanding my search for who's the best provider for this type of patient. Who is the best specialist to work on these feelings or symptoms with. And I refer people very intentionally, because, like, if you have a specialist for your child who doesn't listen to you, and who just tells you what to do, who takes them back into this room and says, well, they didn't really want to do anything, so like they just didn't really participate, and they hand them back, that is wasting your time.
Yeah.
And your energy is running low, your time is running low. Some of these kids are in therapies all day, every day, a week.
Yeah.
So I really think that parents, when they get these recommendations to do physical therapy or occupational therapy, to take the time to actually research what kind of a therapist you want your child to have, because you have to be around them too.
Right.
And they have to share your priorities. And so if you have someone who comes in who's very rigid and you're a family who's very loose, that's just a conflict.
Right.
So you have to figure out how you can work together with your specialists. And so even too, like I find out, locally that a lot of families are recommended to go to Phoenix Children's. Their wait list is almost 5 months long.
Yeah.
For all therapies.
We've waited months and months.
Yeah.
I think initially in the beginning it took us 10 or 11 months until we finally found therapies that could intake us. Like
which is insane, right?
Yeah.
So you're not only wasting your time, your child is potentially just becoming more delayed or more weak.
Just losing time, yeah.
So you need to know that there's other specialists out there. There's not just the big brand name hospital who can help you.
Right.
There's thousands of therapists who are out there. And so if you can call and actually talk to the therapist who's going to be taking your child and say, hey, these are my concerns, that's helpful.
Yeah.
But a lot of the big mills say, like, no, we don't do that. You have to come in, and then whoever evaluates you is different than who treats you.
Yeah.
And then they just shuffle you around. And a child who already can't make a connection with someone, being tossed around is the worst case scenario.
Well, and it's hard for parents too, because you go through the rabbit holes, right? And you've had to explain yourself for the 4th time, the 5th time, the 6th time, the 7th time, that by the time you actually get to that provider,
You're
there's
done.
times where I feel like I'm short-circuiting because I'm like, I can't even, I don't know how many more times I have to say this, because I've had to go through this person to get to this person to get addressed for that specific therapy. So I 100% understand what you're saying, I have lived.
Yeah.
And it is frustrating. It's very, very frustrating. And that's why I think some parents, it's easy just to go, okay, well, they said they'd call us. And then they just wait on it. Yeah, we'll wait. And because there is that moment too where it's like, it's not that I didn't want to address it, but I was just tired. Like I was just tired.
You're walking through the dredges. Like it is tough.
Yeah.
And so if you find one person who you really trust, they should be helping you build out your team of referrals. So that's why I started my own business. I was tired of not having the answers. I was tired of hearing these patients were just tossed back and forth, and you need to have that connection.
Right. So you have the mobile service, virtual, and then you also have the parenting classes, right? For group and individual classes as well?
Yes. So the individual are really just the one-on-one treatments, but those group classes, I've been doing different pop-ups throughout the Valley, but I'm going to be more consistent now in South Scottsdale.
Okay.
And really helping parents learn how and why to play with their child, what toys to buy, how to play with toys instead of putting those toys in front of the child and expecting them, like, well, why aren't you throwing the ball?
Why aren't they doing anything?
Teaching them, like, this is how you teach a child, through modeling, through play, through imagination and creativity. So that way, instead of being this new mom who's already overwhelmed and who just buys the things that are hundreds of dollars, or your Love Every membership that just sits in the box in the corner, it's showing you, like, hey, this is actually how you could use this effectively.
Right.
This is why we play with our children this way, because it promotes development.
Right.
If they develop now, they'll be more successful in school later. They'll be able to have those bonds with you later. But not knowing how to play with your child is common, especially as a first-time parent, especially as a parent who their child now is showing red flags for development, and you start to withdraw. So I really want to focus on what these parents can do early on with those group classes so that they don't need so many therapies later on in life.
Yeah, no, that's fantastic. I absolutely love your approach. And, for our listeners that want to know more about your services and possibly get in touch for you with consultations, is it best that they go to your website?
Yes, so they can go to my website at movingandgroovingpt.com.
Okay.
They can follow me on Instagram at movingandgroovingpt. My email address is on there, my phone number is on there, and I do provide my phone number with all of my patients so they can text and call whenever, instead of waiting on hold and never being called back. I think it's important that you have that ongoing communication. So yes, reaching out on the website or on social media is great, and I'd be happy to schedule that free 15-minute consult with you to decide, is the in-home PT best, are virtual coaching sessions best, or should you come to these group classes so that you can learn in a group setting as well.
Right. Yeah, no, that's fantastic. I absolutely love what you do. Thank you so much for being here today. You're just a wealth of information, and thank you for all the hard work and everything that you've done to help families over the years. I think it's just absolutely fantastic what you're doing.
Thank you.
Thank you for being here.
Yay.
For those of you listening, thanks so much for tuning in today. This concludes our episode for today. If you have questions, comments, or even a show topic that you would like to hear about, please feel free to send me an email at info@piecesformypuzzle.com. Don't forget to like and follow us on Facebook and Instagram if you haven't already, or feel free to subscribe to our YouTube channel as well. If you like what you're hearing, please spread the word so we can help more in the community to provide help, information, resources, but most of all, hope and inspiration. Thanks again for tuning in, and until next time, keep working on your puzzle, and remember, you don't have to have it all solved in a day. Take care.